Good afternoon, New Mexico, and thank you very much for joining us for our COVID briefing for the week. I want to start with thanking Andrea Chavez from Albuquerque, who works for the United States Forest Service, for providing me with this Smokey the Bear mask. And given that all of us are working to diligently do what we can to prevent forest fires and to recognize and thank the firefighters who are currently battling the Medio fire with many others in New Mexico, and the incredible number of New Mexico firefighters who have joined the effort in California. Thank you very much to all those families who sacrifice every day to keep us safe and are doing everything they can to minimize the harm and damage related to fire season and these current forest fires. Like we always do, I'm going to take my mask off so that I can be heard more clearly, and we're going to go right to the case update. All right, today we have 190 new cases. That brings our total cases to 24,920. We have 68 hospitalizations, 16 people on ventilators. That's continuing to go down. That's a very encouraging sign, and we're going to talk more about that, but it is something that we pay close attention to. Unfortunately, we are announcing 9 new deaths. That brings our total to 764. And as always, I know all of New Mexico joins me in providing our sincere condolences to the families who are tragically affected by this deadly virus. And it always is a painful part of the briefing to announce directly to New Mexicans that we've lost, indeed, 9 more beautiful souls. All right. With that, we're going to go, and let's do the last thing on this slide. I was almost going to skip it. I do think it's worth noting, and I'm expecting we'll have some more conversation about this during the press conference. We've now conducted 740,366 tests. We continue to be in the top 3 states or so in the nation for testing. I want to just alert New Mexicans that that's becoming continuing saga of challenge and challenges around the country as all of the states are competing for the commodities on the front end, swabs, tips, the test tubes, and the reagents on the back end. But we are managing and keeping up and hitting our testing gating criteria, which you will see with the update from Dr. Grace. But that is an area that I want at least New Mexicans to be clear that that's an area that we have to pay close attention to.
Well, just no, don't cut the feed. Just we got to figure out the audio. It's up now. Yeah, is there audio? It wasn't at the beginning, but it should be good now. Can we do a test? Just Governor, will you say, can you hear me?
We apparently are having audio trouble, and my job now is to make sure that everyone can hear us. Thank you for being patient, and thanks for alerting me. Dr. Grace, to you.
Thank you very much, Governor. It's great to be back. It's always more fun to be back when we have good news about how we're doing in the state, and so I'm delighted to be here today. We'll walk through some slides. We're going to focus a little bit more on children and the rest of the press conference related to both what we know medically about kids and what we've learned in the past 4 months, and also schools and what the plans are with Secretary Stewart coming up right after me. So if we go to the first slide, this is our epi curve. That top line is the dotted line that shows the number of cases, average number of cases per day, and we average it over 7 days. There's a 6-day lag in there, so we get complete data with lab tests from out of state that were sent out of state, coming back at a very, very low point. If you look at this graph, you can see it's been a long time. Matter of fact, since June. Now we have had a couple higher case counts the past couple days, so it's going to rise a little bit. But we're in a good place, and if you remember from last week or the week before, our gating criteria, we want to be below 168 cases in New Mexico a day, and so we're definitely hitting that mark. You can also see that pretty much across the state, the regions are labeled down below, lower levels everywhere or levels coming down. Of course, you're going to hear more about the Southeast, where we have the biggest number of cases per person or per 1,000 or 10,000 people. And we also have our eye on the Northwest, because we're seeing, after 5 months of not much activity, we're seeing an uptick in cases there just over the past week. The next slide are our New Mexico heat maps that we show. The left one is the total number of cases that have occurred in each county since the beginning of the pandemic in New Mexico on May 11th. You can see Tobacco County still holding out with no discovered cases yet. I get up every morning and smile and root for Tobacco County that they continue to hold out. Two things to notice, though. We focused on the northwest part of the state for many, many months, and things have really cooled off there. And now notice that the southeastern part of the state is starting to get darker. And the map on the right is just the number of cases in the past 2 weeks. And you can see there that there's actually more activity in the southeast part of the state than there is in the northwest. Bernalillo still has a large number of cases, but a much, much larger population, and still a fair amount of activity in Doñana County with their folks, with the folks in Las Cruces. The next slide, one if you're a regular viewer, you're used to looking at. On the left, this is the percent of total COVID cases distributed by 10-year age groups. And you can see, if you look at the slide carefully, that 20.1%, the 20 to 29-year-olds have established a formidable lead as being the highest percentage of cases in New Mexico. They really have, if you remember months ago, we saw very few cases in younger people, a lot more cases in older people, and that demographic is shifting, as you can see, to younger age groups. And that's relevant today, too, when we talk about schools. The number of people under 20, the percent of cases is almost 16%. And for those of you that, sorry about that, excuse me. And for those of you who want to know just children, which is 0 to 17, that's running about 12.5% of total cases today. On the next slide, I always like to have something about masks and healthcare and the like, and so you can see some New Mexicans here wearing their masks. And remember, now's the time to get kids their immunizations. We're talking about going back to school today. Get those appointments, get those kids those physicals, get them their immunizations for school. Flu shots, aiming to try to get everyone in New Mexico immunized between September and October. We're purchasing large amounts of vaccine. We'd like to, number one, sort of hit the record for the percent of our population vaccinated against influenza this year, because that's going to help us in the winter, sorting things out medically between influenza and COVID infections. And number two, we want to get those vaccinations out of the way so that when the new vaccines come out, we have the capacity and bandwidth to get as many New Mexicans vaccinated as quickly as we can with the supplies that we have. And then just a reminder for adults too, if you've put off those preventive checkups, health screenings, mammograms, maybe checking your cholesterol, if that's something your doctor does every year, whatever it is for you, please make a call. Get those done. This isn't a bad time to get caught up in those elective procedures before we do go into the fall flu season in the winter. Adults need immunizations too. Check your list. If you can check your medical record online, that's even better. See what you need and get set up to do that. If I could please have the next slide. I want to give you a little update on vaccines. This is a pretty busy slide. And just a couple things, though, because there was a lot of interest, particularly from the media, on who, what, when, where, and why. And so on the top, there's all the steps in the vaccine that include prioritizing populations, allocating the vaccine across America and in New Mexico, distribution to get the actual vaccine to providers and to DOH sites and the like. Then there's the administration of the vaccine. That's getting the shot. That's the thing we're all focused on. When do I get the shot? And then after that, there's measurements regarding safety and effectiveness. And some vaccines, most of the vaccines are going to require 2 doses for COVID, not just 1. And then the recovery process and everything else that the state does to look at the data and monitor effectiveness. There won't be much on the lower graph. So this administration part I've blown up to show you another slide. These slides are from the CDC, although we've inserted the dates on the lower portion to help you better understand. On the y-axis here, you have how many doses are going to be available, and you're going to see here that not many doses are available. We have 5 vaccines in phase 3 trials. They're being tested on 30,000 individuals each, and so we're going to have great experience. There's a 6th vaccine coming online to enter phase 3 this week or next week, so we'll have great experience. Unfortunately, the vaccines are different. There'll be different administration procedures, 1 or 2 vaccines, storage, whether they're safe for pregnant women and kids and all that, but we'll have all that sorted out in time. And so most of the vaccination that we hope to administer will occur in the first 2 quarters of next calendar year. So that's something to look forward to, and you'll be getting more and more information. Remember, in a pandemic, priorities for vaccines are enforced, and so providers have to sign a new contract that says, I will, in exchange for getting some of this vaccine, I am going to give it only to high priority populations until I hear otherwise. And so those folks being discussed include, of course, older, frail adults, healthcare workers, teachers has come up, and all of those are under consideration. As we get closer, we'll give you all that data and update you on that approach. Next, a couple things on masks I wanted to mention. Hopefully you'll see these in the public health order at all. Number one is we're not really asking the public to wear medical grade masks. We're trying to save those for healthcare providers. But on this slide in the lower left-hand corner, you see a mask with a valve. And masks with valves should not be used. While they may provide you some protection, that valve just blows all that water vapor from your breath out into the general public and the surroundings. And so they are not really safe to be worn to protect other people from you. Everybody, we're hoping, will find a multi-layer cloth mask that they can wear for public use. We're going to be recommending those for schools as well. And while face shields are worn by healthcare workers to, for example, obtain COVID swabs and do procedures that create aerosol, they don't really protect other people. And so for general public, and Secretary Stewart and I have talked about this a lot in schools, a face shield alone is really not acceptable except in very, very rare situations. So teachers who want to protect themselves and protect their eyes, and that's the main idea of face shields, is to protect you from getting water droplets in your eyes that could infect you. We're really asking everyone to combine a mask, if you're going to wear a face shield, with a face shield, but should have a mask on underneath. And so that's the way we're going, and I think you'll see something in the public health order about not having valves in masks, but just a reminder to all of us, we've mentioned that before. So I want to talk a little bit about kids, a few slides on kids, what we're learning. We've learned a lot in the past 3 months. We were hoping we would have a lot to learn about children and that research data would be coming out steadily about kids, and there's indeed a lot of information, both in other countries and now some coming out in the United States. I wanted to highlight our child care efforts in the state because I think there's something that we should really, really be proud of. First, there's an article about what Rhode Island did and in their child care system, they, as they reopened, very strict social distancing, universal masks for adults, screened everybody coming in every day for symptoms, very strong cleaning protocols, and if there was a case, closing down, quarantining everybody, and the like. And they've been able to reopen 75% of their programs. And so that's great news. Also good news, or maybe even better news for us, is the fact that New Mexico started doing all these things and then some early in the pandemic. And so you can read these things, but we have kids wearing masks as well. We have a testing surveillance program. And actually, this is important because that surveillance program has been really successful, and we're also using it. We're also proposing to use it. We don't have all the details yet, but to use something similar in the schools to monitor teachers primarily, to make sure that they're not carrying the virus. We reduced class sizes in child care, similar to what you're going to hear more about in schools. And we have a very effective rapid response system developed by Secretary Kinney and Secretary Elizabeth Graginski in early childhood that has really worked out well. We've got 7,500 staff in child care, 8,500 kids, and have had only 135 cases in staff, 59 cases in kids. Very, very low infection rates. And so that means that we can have adults and kids in the same room wearing masks and contain potential outbreaks. And so that's valuable information for us in New Mexico. Next slide, just a brief stop here. What we basically understand now about kids is that for the most part, we should think about them in terms of carrying the virus and infecting others the same way we think about adults. Now, the public opinion and expert opinion about this back in March was the opposite. I think our state took an early position that we were going to treat kids as though they were adults until we had evidence that proved otherwise, hence the masking in child care centers. And that turned out to be a good thing because now we're finding that kids do carry the disease. They can spread it, and we ought to take the same control measures with children as we do with adults. There may be a little bit of difference with kids, and it's interesting because children between about 2 and 15 do really appear to have much less severe disease, but then children under 2 may have more severe disease, and teenagers in the late teenage years appear to be more severely affected as well. So we'll get more data, but I think our hunches prove true, and all the planning that's been done in a variety of settings, childcare, schools, and all, has been informed by this. There is a disturbing report on the next slide about the possibility of an increase in type 1 diabetes in kids who have COVID infections. We know that viruses can cause autoimmune responses that can disable the pancreas that makes insulin in kids. This is not evidence that this is happening because while they had about an 80% increase in cases early in the pandemic in England, other countries now are just very interested in this, going through their data, and in another couple weeks, we will have more information. I'm confident in September we'll find out more information to really pin this down and know if this is a risk or not. But it's just a reminder that COVID can be a very, very serious illness, and we need to take it seriously in all of the aspects of our life, including what we're going to talk about with school here in just a minute. And with that, if we could go to our gating criteria, I'm going to talk about those briefly as well. New Mexico still doing well. We're yellow. I've gotten some emails from some of you saying, hey, when are we going to be green? When are we going to be green? And I'm hopeful. I've got my fingers crossed. If you squint or get your nose really close to your computer screen, you can see that third number from the right on the top says that the new cases per million per day is 65. That, if you multiply that out for New Mexico, that works out to about 136, 137 cases a day, which is right about where we're at. And if that number got to 40, or we got to 84 cases a day, then we would finally turn green, as you can see some of the New England states are doing. But overall, the news is great. I don't have a specific slide. Well, let's go to the next slide that lists all the gating criteria, and I'll make comments about each. Our spread rate is stable. It's below 1, which means each person who gets COVID is actually infecting one person less than one person, excuse me. So that means transmission is going down, and of course we're seeing that in the curve. Our daily cases, we talked about the official number here on the 20th was 118. Remember, we have that lag, that 6-day lag. Testing, still doing well in our testing numbers. And our test positivity rate at 2.5% is the best. Not only is it the best in the West, no other state west of the Mississippi is as low as we are, and low is good on this measure. But you have to go all the way to Virginia to find a state that's doing better than we are to the east. And so this is something to be proud of, and also something that makes it safer for us to consider reopening because we have adequate testing. Contact tracing, doing well on contacting initial cases. We've slipped behind a little bit on reaching the contacts of cases, and so that fell behind a little bit this week. There's a variety of reasons for this. It's not just one thing. Some data issues. We're working out of 2 different databases. Hopefully we'll have a resolution to that soon. And then lastly, our hospitals are doing quite well in terms of COVID cases. You saw the number of hospitalizations. You saw the number of ventilator cases. They're at the lowest they've been in quite some time. And the CEOs of the major hospitals around the state are telling us that they are seeing record low numbers of COVID patients in their facilities since April as well. So everything looks good. I want to take a couple minutes to focus on those 2 numbers that we've added to the criteria that are getting a lot of attention nationally and we believe give us really valuable information. One is the case count, and the other is this test positivity rate. And on the next slide, you see a little bit of a complicated grid. Those little tiny black smudges are actually the names of counties. And let me explain the grid. On the bottom line here, what some of us call the x-axis, is the average daily cases per 100,000 population. So we would take the number of cases and divide by the number of 100,000s in a given county. And that way we get a sense of equalizing the counties to know how many cases there are. So that's basically a population rate of cases for each county in the state. And on the y-axis, the vertical axis, you've got the test positivity rate. And we've talked about this before, and I'll show you the map of this, which I think is easier to read. But I just wanted you to see how this worked out. So if you're in the green section of this graph, it means that you're hitting the mark on both of those things. Your case counts are under 8 per 100,000, and your testing positivity is below 5%. Orange, we don't have anybody in right now, but that's a high test positivity rate, low case count. Yellow, good test positivity rate, but rising or higher case count. And red is where you're not doing well in both. And so right now, Eddy, Chavez, Roosevelt, Hidalgo, Quay, and Lee are in the red category. Now you'll see people are close to the line, and some people aren't very far from green, and that's the nature of these things, is you have to pick a number and you have to draw a line. But we're hoping to work with all of you to move as many people as we can into the green zone soon. You also may know, I'll show you the next slide is the map of New Mexico. We'll come back to this with a little bit more detail later, but this is the map we're using, and this is actually the official version of the map for September for nursing home visitation. And so those counties that are green, which is the vast majority now of counties in the state, can make appointments with nursing homes. You can visit your loved ones. Probably one of the most satisfying parts of my job since I've been doing this COVID work is hearing from some older adults who've gotten to visit spouses for the first time in 5 months, and virtually every one of them, as they told the story, had tears in their eyes, and I have to confess that I had a few by the time each of them were done as well. So it's very gratifying. Thanks to everyone in New Mexico who's done the work you have to get these case counts down in most of the state, and there are real benefits. We make things safer, and we can reconnect with some of our loved ones when we do that. As I said, there's a lot of fine detail about these metrics, and I'll come back to those later after Secretary Stewart is done telling you about the plans that have been made for schools. So my almost last slide here is the next one. The virus is the same. It stays the same. It's ready to infect anybody who puts themselves in a position where they can get infected. And we really can only proceed with this very gradual reopening if we all continue to pull together and we continue to do things to stay safe. We're at 7 of 8 gating criteria. We're really, really close. But we have to work to fight the virus, which means staying at home, washing your hands and keeping things clean, everybody wearing face coverings in public, maintain that social distancing. And just a reminder, I've got my 2 light switches here. As we begin reopening, this is not an invitation to go back to doing everything we've always done. We're not turning the switch from off to on. It's a dimmer switch. I tried to find a dimmer switch that wasn't as far up in the up direction, but I couldn't, so I had to use that one. But we just want to open up a little bit. We want to be really careful. We want to do those things that we know work, and then give ourselves 4 weeks to see what the results are. We tried this once before. It didn't work so well. I think many of us were in the on-off switch mentality. We have to change that. And then just as I close, just a reminder, 2 more things. It's a commercial for Labor Day, and this will be available on our website. But we know that larger group gatherings and family gatherings have been the source of a fair amount of transmission of COVID in our state. It's one of the most common things people relate to us when we call them for contact tracing. There's a way to do it safely. There's a way to do it right. There's a way to be careful and still connect with people. It's just for this year, and hopefully this year only, it's going to be smaller numbers. So I think the biggest thing we all can do this Labor Day weekend coming up is have good plans, make safe plans, keep it small, and do the things that we know have worked in the past so that those sorts of activities don't contribute to an uptick in cases, that it will slow down our ability to do other really important things like school. And so as I'm closing, well, you can show the last slide, but I want to thank all New Mexicans. I mean, this is really you that's done those work. We tend to look at these curves going up and coming down and think about the virus, but we really should be thinking about ourselves and those measures we've taken to stay safe, because that's what moves those curves back down, is staying more safe and being more careful. So let's keep that curve down, New Mexico. Let's be safe, and let's make New Mexico the safest state in the country for kids to go back to school. And with that, I'm going to turn it over to our governor, who will introduce you to our education secretary.
Thank you, Dr. Scrace. So we were having audio trouble, and I'm just going to repeat a couple of things. I want to thank Andrea Chavez from Albuquerque, who works for the U.S. Forest Service, for providing me with this mask today. And Smoky Bear mask is a great reminder to thank so many of our firefighters and firefighter families and first responders who are right now battling the Medio fire here in Santa Fe and many other fires currently in New Mexico, as well as firefighters from New Mexico who answered the call for help to California to combat their wildfire blazes that, as many of us are watching with great concern and horror, is ripping through so many of California's incredible forests and communities. I also want to make sure that everyone tuning in heard me offer New Mexico's condolences to the families who have lost loved ones to this vicious virus, and that it pains us to announce that we've lost 9 more New Mexicans in this pandemic. All right, I'm going to take my mask off. Thank you, Andrea. And let's go to the public health order update. All right, so we are amending the public health order. It is effective Saturday, August 29th. And some of this information's already has been made available. And I want to just reiterate. Houses of worship may now operate at 40% capacity. I want to remind folks who may not have always tuned into every one of these, they have to meet COVID-safe practices. They're doing, I think, an incredible job, and I appreciate the leadership in the faith-based community for assisting the state and working with the Department of Health and other experts to make sure that face coverings, so wearing masks and being socially distanced and doing all of their outdoor services and online services has really made a difference in combating the virus in New Mexico, and we really appreciate that. But we know patrons and members of your churches who really want that experience with their pastor or faith-based leader. We want to make sure that we're easing into that as well. Restaurants, so food and drink establishments, can now do 25% indoor capacity, and then outdoor dining, if you've got room to expand, you can go to 75% of your area. Again, they have to follow the same COVID-safe practices: mask wearing in line, metering to get in, 6 feet apart, limitations at tables. And I just want to remind folks that the restaurants, indoor dining is one of those activities that's just high risk. close ventilation, close contact, you stay a long time, so duration factors, and you can't wear the mask while you're eating. And that's not a restaurant's fault or an establishment's fault. That's how that works. That means that we really have to work hard. And in the COVID safe practices, I thought it might be useful that restaurants have done, by and large, an incredible job in all of these businesses. But New Mexicans have to help. Don't communicate with your food server without a mask on. Wear your mask while you're waiting. Keep socially distanced. Wear your mask while you're waiting for your food if you can. The more that you wear the mask, the fewer droplets that are being provided or exposed to the indoor space. And you have to do your part. And I worry that, particularly based on what we see posted and communicated to us on our complaint hotlines, that folks send us photos and talk to us about that once people get into even the outdoor dining at a restaurant, that all of the COVID safe practices that we really are working hard, not just to promote, but we hold these businesses accountable to. They must adhere to them. The patrons are really difficult in these environments. And so I'm going to ask New Mexicans again that if you don't help us, that puts these businesses at great risk of failure. They can't do it successfully without your participation and cooperation. They can't. So keep supporting these COVID safe practices. Do your part, and we believe that we can be successful. Museums with static displays may operate at 25% capacity. So they've been closed, and we're doubling the number of individuals in what we call a mass gathering. So no more than 10. I want to talk about that just a little bit more because Dr. Scrace leaned in for Labor Day. So what really happened when we were meeting our gating criteria, we were learning about positivity rates and case counts in a way that we are now measuring, right? We're building that goalpost so that we really have data that gives us insight about what's currently happening, what we can project out, and make sure that we can respond to a potential outbreak. It's all of that and protecting our healthcare workers and saving lives. But these are the tools by which we determine how safe is it and how much risk, if any, can we introduce. Labor Day is just like July 4th and Memorial Weekend. And as we were either introducing a little risk later than that around July 4th, or we were actually cautioning folks, I have to remind New Mexicans that our caution did not work, that we were turning away people at parks and at lakes. Folks were trying to camp. There were large gatherings. People would not wear masks. We had lots of folks from out of state. And the end result of those careless moments, or where we felt like we could ease up if the signal from the state or the nation was that things are getting much better, that the virus would disappear over the summer, whatever it was that caused anyone to feel like it was safer, it created these problems where the only option for us was to not relax some of those restrictions, pause on a lot of our introduction of risk, and wait. And really focus on trying to create safe environments for kids in reopenings of schools in some context. Here, I'm really proud of New Mexicans. And introducing this amount of risk, I wouldn't do if we didn't think it was safe and if we didn't think we could do it. But at the end of the day, I'm sitting here in a legislative hearing room in Santa Fe. I can't make New Mexicans, even with the enforcement tools we have, follow these safeguards unless you're willing to do them. And I want to give you an anecdotal, this is what I see. Last week, I traveled to northern New Mexico. And in traveling to northern New Mexico, I went through Espanola. I saw a lot of activity in Espanola traveling through Main Street as we were going north. I didn't see a single mask, not one. Not in a parking lot, not outside a grocery store that we passed, not at a convenience store, not at a gas station, not by someone in a car, not hanging on the rearview mirror, not on a wrist, not as people were walking, nowhere. Not one. The only masks I saw were in the car I was in. And we have to do better than that, because if we don't, we cannot successfully introduce risk. And what I know is coming is it's going to get harder in the winter. And between now and getting a vaccine, if we don't double down our efforts to make New Mexico safe, the virus hasn't gone anywhere. It's all up to us. Then we can't successfully keep doing the work that we're doing. And I just really want folks to be proud and feel good about the work that you're doing and see that it does make a difference, and also be really clear that we aren't doing enough. If we were doing enough, I wouldn't have spikes in cases to 209, 210, that we would be at 100 or lower nearly every day. And we can get there again, and I'm expecting that you're going to do as much as you can to make sure that we do get there. I don't want to lose sight of this before we go to education, which is we're winning, but you got to take that into perspective. I announced 9 additional deaths today. People are still getting the virus. We have far too many children in New Mexico who have the virus, who have been infected. We're seeing far too many younger people who are also contracting the virus, who I also want to just say, I think by and large have not been adhering to our 5-person gathering or family gatherings. And if we don't do this right, we will not be in the position to continue to talk about where we're introducing risk. And the last thing before we go to education, I want to thank the Economic Recovery Council. The suggestions about how we introduce risk, where based on the data we can go first, how that squares with the economic protections we want to continue to bring and reinforce, is happening because so many business owners who volunteer their time and expertise are participating weekly on the Economic Recovery Council Task Force. And largely these relaxation of the public health order comes directly from their efforts at looking at what we should do once gating criteria is met for a considerable amount of time or is close enough that we think we can adopt a little risk. All right, so let's talk about schools. If we can do this, what is the plan for schools? What are we looking at? What are we thinking about? And I hope that Secretary Stewart from the Public Education Department can at least give people a sense about where we're headed, how it looks, and also get your burning questions answered today. Secretary Stewart.
Thank you, Governor. And I want to start off by thanking the staff of Bloomfield Public Schools for giving me this great mask on my recent visit up there. Also want to thank the staff at Cuba, Rio Rancho, Albuquerque Public Schools, and Aces Tech Charter School for also welcoming me in and showing me all of the preparations that have been done to bring students back safely. As I've had a chance to visit and be able to see the preparations that have been happening across the state, one of the things that we've put as first and foremost in our guidance is that we have to be able to ensure the health and safety of every single student and every single staff member educator who comes into a school building when we start bringing students back to campus. And then we also know that despite the work that we do around making sure that we have much more robust online learning programs than we did in the spring, that there is no substitute for in-person learning. So we have to maximize the amount of in-person learning that we can do safely across the state. So to that end, the Public Education Department has been and will continue to keep working with our school districts, our school boards, and our public health officials to make sure that both on the instructional side and the academic side, we have strong plans in place to make sure that as the public health conditions continue to move in the right direction, as we see things continue to be on track to meeting the gating criteria, getting more counties into that green zone that Dr. Scrace spoke about earlier, that we have the plans in place to start bringing our students back and be ready to respond whenever we do see a case so that we can very quickly respond to it, contain it, isolate those individuals, close the school buildings clean, and then bring students back safely so we don't see large systemic outbreaks across the state. So if you could go to the first slide, please. So as we get into the phase where the public health conditions are allowing us to start slowly and deliberately phasing students back in using a hybrid model and starting with elementary schools, these first two bullets that you see for requirements for reentry really are about our capacity as a state to make sure that the work we're doing will, for the first bullet, meet the statewide gating criteria, so our system has the ability to be proactive and responsive to any outbreaks that we see. And also so that we see for any place where we do start allowing students to come back in, allowing staff to come back into the building, that we're doing it in a region where the public health conditions, when we look at the test positivity rates, are low enough and the new daily case rates are low enough where the likelihood of a student or a staff member entering into a building with the virus and spreading it to others gets as low as we can safely make it, so that we don't have to get to a point where people come into the school and then we're immediately having to close it and shut it down. And I know many of you who have been watching the national news, we've seen many cases in other states that didn't take necessarily the same precautions that we did, that didn't have the mask requirements, that didn't have the social distancing and the hygiene and the cleaning requirements that we do, where that was exactly the case. So we are taking every precaution that we can to stick to that first principle of keeping people healthy and safe and to maximize the amount of in-person learning that we have. In addition, we know that when we're bringing students back and we're stewarding their learning through this pandemic, that the work that we have to do, and this is more challenging than educators have ever had to face before, but we know that the work that we have to do around providing a high-quality instructional program and meeting the needs of the whole child have not waned. We still have to meet those needs. Our kids are counting on us each and every day. And I want to thank some of the great teachers who I had a chance to pop in on your online classrooms. Ms. Cavender, Mr. Ippel, thank you for letting me pop in and be a part of your classroom for a minute and talk to your students. I just can't say enough how much energy, effort, thought, planning has gone into taking what we had to do very quickly in the spring and then putting more systems in place for the fall, and now that we're here, so that we're able to, even though it's not perfect, be able to continue providing continuity of education. We've heard loud and clear that significant challenges still remain. Significant challenges around broadband infrastructure and connectivity. Our districts are working. We continue to work to find those individuals who have not yet been connected, who do not yet have a device, to make sure that we get those students and those families the support that they need to participate successfully in the remote programs. But we also know that we're excited that the efforts of New Mexicans and all of the hard work that has gone and the sacrifice that has gone into containing the virus, bringing our case counts down, are getting us now to the point where we can slowly start phasing back in-person learning. So if you can, actually let me talk a little bit about the last bullet on here, which is around the safety and support plans that we have in place. So as we get closer, we know that there is a significant amount of questions and anxiety from parents, from students, from educators around, does my school have the systems in place to make sure that my safety will be attended to and that we will be adhering to the requirements for social distancing, face coverings, and other enhanced safety procedures that we've outlined in our school reentry guidance. And so across the state, we're making sure that every single school is going to have the masks that are needed, is going to have the cleaning supplies that are needed, the cleaning procedures that are needed, and the rapid response protocols and contact people that are needed in order to make sure that before they open, those things are solid, they are in place, and all of the individuals in that school can come with confidence knowing that those provisions around their safety have been very closely monitored and attended to. And I was very pleased to see in my visits the care and attention that our superintendents and our administrators and our teacher leaders and our custodial staff and our food service workers and everybody else who's had a hand in this have put into making sure that these systems are in place to be able to welcome folks back. And I just want to reassure everyone that the Public Education Department takes that responsibility very seriously, that those conditions are in place before students step on. If you could go to the next slide, please. So Dr. Grace showed this slide a little bit earlier, and I'll talk a little bit more about it here as well. When we look across the state at where our counties are in terms of those test positivity rates and those new daily case rates, we know that in the southeast, we certainly have hot spots, and certainly in Hidalgo County in the southwest, but the vast majority of our state is in the green zone, which is great because we need to be able to say that to every educator, every student who comes in, that we're only opening schools when we've gotten to the point where the likelihood of somebody walking into the school with COVID has been reduced, and the likelihood that this disease is spreading in any particular community has been reduced to the point where we can do that safely. So we're still a little while out until we get to September 8th. We'll continue to monitor where these counties are, what their rates are looking like, and we'll continue to keep that updated. We know, and I will just make the same plea that I know that the governor and Dr. Grace make, that the more we can wear masks, the more that we practice social distancing and all of the requirements to drive those case numbers down, we can turn more of these red counties to green, because we want to be getting, again, maximizing safe in-person learning for as many students as possible. But as we're looking at bringing students back after Labor Day, we are only bringing students back that are in these green zones. Next slide, please. At the Public Education Department, we have a number of activities that we're focusing on to make sure that, again, all schools have those procedures in place, starting with an academic plan. For the last several weeks and months, we've been working with schools and districts around their academic plans and their communications plans to make sure that those are strong. So we'll continue to be working with schools now all the way up through when they start bringing students back to make sure they have an approved plan. We've been working in partnership with our Department of Homeland Security and Emergency Management to both identify where we have masks and PPE and where there are gaps out there in the field. And we're distributing 700,000 additional masks out into the field, in addition to other gowns, gloves, and medical grade masks for those personnel who will be working with students who require more proximity because they have special needs that have to be attended to make sure that they have even more enhanced PPE to be able to make sure that they're able to perform those duties with the right equipment. We've also been working in partnership with Department of Health and our Environment Department on our rapid response system. We've had a number of superintendents who have also been helping to make sure that we're able to streamline this system. I think we still have, as we've seen individual cases pop up amongst staff even before students come back, a number of things that we can improve upon in this area. I take responsibility for making sure that we do improve upon that we have a seamless and highly coordinated, fast, and effective system for every single school. We get better at it with each time that we have to respond, unfortunately, that when there is a case. But we know that making sure that we have a point of contact in every single school, every single district, and a whole team of people at the Public Education Department who are going to be ready the second a case that we're notified of a case to respond, to identify those individuals who are close contacts, make sure they're quarantined, coordinate the testing, and provide the school with guidance around closure and reopening. We take the enforcement of this incredibly seriously. We simply have to keep the health and safety of every student and every staff member at the forefront of every single decision that we make. So both within the public education department and across other state agencies, we will be stringently enforcing these guidelines, and where we have to, moving schools back into remote learning if we're finding that the protocols are not being adhered to. And so the safety and health of every single student and staff member is priority number one. And then finally, and I'll talk a little bit more about this on the next slide, going through with districts on their school closure procedures in the event that there is a case. And can you move to the next slide, please? So as a high-level summary, and there's significantly more detail as we go into the individual case elements, you can see here on this slide the ways in which we're going to respond to cases. So when we have cases that are contained to individual classrooms, we will be closing that classroom, cleaning that classroom, and quarantining the students and staff members who are in that classroom. So they'll have to move to participating to a remote learning program until they're cleared to come back. When we see cases that are spreading across multiple classrooms within a defined physical space or wing of a building, then we'll be closing multiple classrooms or a wing, not necessarily the whole school. We will move toward closing the whole school when we see multiple cases that are spread across the building. And in those cases, we will need to close that school, have all of those students and staff members participate in the remote learning program until that quarantine program has ended and they're able to come back. Next slide, please. So New Mexico, we have a big challenge in front of us because schools are some of the most complex, largest, interdependent organizations that we have. But the work that we're doing is going to put us on a path to be a model for how we can do this smartly, how we can take clear and deliberate actions to make sure that we're keeping transmission rates low and not moving too fast, and set us up to be a model for what this can look like for the country. At the Public Education Department, we're going to continue to be evaluating these reentry plans and proposals, working very closely with our charter schools and our districts to make sure that all of those academic, social, emotional, and instructional elements are in place. We're also going to continue to monitor that they have sufficient PPE to make sure that every single student has the mask, every single staff member has the PPE that they need if they're in a close contact situation, has a mask, and is adhering to those social distancing requirements. We're going to make sure that we continue to invest in the remote learning program. We've put significant investment into an online learning management system so that every family, if that family makes the choice that their student should not be coming back yet for their medical reasons or their family medical reasons, that they have an online learning system that they can access with high quality instructional materials and support that goes along with that, so across all charter schools and districts in the state. And at the Public Education Department, we're going to continue to emphasize outreach to educators and local leaders and making sure that we're really taking into account all of the perspectives on how this is going, that we're continuously getting feedback on where we can be doing this better, both at the state level and at the district level, and rapidly responding to opportunities to make sure that in this unprecedented new way of operating schools, we're continuously building upon the learnings and experiences and making it a healthy, safe, and positive experience for everyone involved. And with that, we'll turn it back over to Dr. Scrace, who will give a little bit more context around the health and safety aspects of this.
Thank you very much, Secretary Stewart. I'm just going to take a minute and see if I can preempt some of the inevitable questions from Julia and Dan and others that relate to mathematics here. And so if we could bring up either one of those red, yellow, green maps of New Mexico that we've had up, I just want to talk through a little bit more. There's a little bit more work that the modeling team and epidemiology is doing. The modeling team has spent all summer basically focused on school reopening and analyzing multiple scenarios. Paul Fenimore and Sarah Duvall at Atlanta have just been amazing and patient with us as we ask them to try one more way of looking at this. And we think we have really good data. The simplest summary of all the work we've done is that safe school reopenings occur in COVID-safe places. And safe school reopenings do not occur in COVID unsafe places. And that works at the country level, the state level, and the county level. And I know there's some apprehension about reopening schools. If you watch the news, you've seen Georgia and Alabama and Mississippi and Oklahoma and Indiana open and then have to close and quarantine people. I do want to say if they had had our gating criteria and used them, they never would have reopened schools the way they did. And we are in a much safer place than any of those folks. So we will be doing this map, putting it on the web about twice a month. We'll use it to make decisions about school reopenings about twice a month. We're working out the fine details there. Some other really important things we're looking, we want to smooth the data out. We simply can't tolerate, and the schools can't live with any kind of on-off sort of thing. So we're looking at a longer rolling average, like 14 days. We understand that this works really, really well in counties with larger populations. Bernalillo has 680,000 people, but we've got 7 counties in New Mexico with less than 5,000 people. So we're going to look at that and have a special way of evaluating that so one case doesn't throw them from green to red or vice versa. So we're working on that, and we'll have more details about that before Labor Day. I think Secretary Stewart did a great job covering the rapid response and sort of the classroom, wing, and whole school level. We are going to have some criteria for closures. They're not going to be the same as criteria for opening, and because we're making room here. We have these tough criteria to meet to start reopening, and we purposely did that to have a little bit of room for some case growth without adversely affecting schools. And then lastly, there's a plan, groups meeting today, and we'll be continuing to meet to find a way to do surveillance testing based on the model we used very successfully in child care and other congregate living situations, nursing homes, to ensure that we're keeping our finger on the pulse of what's happening around the state and schools and keeping our teachers and our staff, and most of all our kids, safe, so the parents can be confident that when you send your child to school that day with their mask on and with those instructions to not touch others and to stay, to keep their distance, that they'll be in a safe environment. So we're continuing to work on that math. All the details will be made publicly available. When we do this, we want the school districts to have the exact, know what the exact math is we're using in those smaller counties so they can plan and predict as well. And just to all of you, please stay safe yourself. Even if you don't even have school-age kids, you can affect the success of a safe reopening of schools in New Mexico. Thank you. Governor.
All right, so right before we take questions, I get the sense with all of us that it feels like we're not celebrating. We are. We've created, I think, a very productive balance between constantly looking at the economic issues related to the pandemic. Every country, this country is not excluded, is challenged by the fact that there was not a national pandemic response or plan. States largely left to their own, and then figuring out ways to protect our populations currently, right? And then I got to look at it the next day. Am I still protecting them from transmission? While really thinking through how you introduce some risk so that we can stabilize some of the economic downturn and consequences of living through a pandemic. The same is true in education. We know that students and parents in many school districts and schools are really anxious to return to in-person learning. We also know, we have data without a pandemic that shows us unequivocally that the socialization and supports in a school, not just for the student, but for the whole family, are enhanced in an in-person environment. And we have a ton of international data that shows that the relationship between an educator and those students, that close personal contact, has everything to do with productive educational outcomes, right? I know my students, they trust me, we have a relationship, I can motivate them, and I can also recognize when a challenge is too great and come at it a different way. These are not normal sets of circumstances. One, just as to reiterate, We are not mandating that schools go to in-person learning in this hybrid model. We have 24 school districts whose school boards have elected not to pause and postpone in-person learning until next semester. Now, those school districts, their relationship with the public education department will be to enhance distance learning. We know there are challenges. There are challenges for those parents. There are challenges for those students and families and for educators. We have to do that as well. And even schools that are eligible and ready and interested in doing in-person learning still have to support parents and educators that have any number of issues about in-person learning and will still have to maintain distance learning opportunities. So we are still doing that, right? There's kind of all of the above, no wrong door, and starting it with low positivity rates in those counties means that we don't have the same prevalence of the virus. We can predict out with some degree of certainty that we'll have less transmission because of those rates. That means students and educators are safer in these back-to-school environments. And then as we take a look at what occurs as a result and whether the COVID-safe practices are being adhered to as a result and are working the way that LANL and our other healthcare experts, our scientists, have determined, then we can make the next set of decisions with schools and parents and school boards and educators. And I also want to thank all the educators who have rightly pointed out that there are still challenges, not just in New Mexico, but all across the country, with adequate personal protective equipment, PPE, masks, and related. And we are going to have a very hands-on approach to support districts to get what they need to make sure that students and educators are all protected to the highest degree. So again, it is all really good news. It is. And I am incredibly proud of us as a state. But the virus is still here. We are still going to be incredibly challenged by this virus until there's a vaccine. Public health scientists are predicting a troubling winter and are basically signaling to governors and to states, be ready. Be ready to deal with more virus and more issues. So, and we also know more activities will have to go indoors. That means we've got to get the indoor part right to the highest degree possible so that we have economic opportunity. We have things for individuals to participate in and do. We can meet our educational requirements and supports, and we don't end up in a situation that the other states have, where you have to close whole schools, roll back, or universities that have just suspended in-person learning. Slow, steady, pragmatic, prepared. That's how New Mexico is going to keep succeeding as we move forward. All right, let's open it up for questions.
Thank you, Governor. First, I will start with Matt Grubbs with New Mexico PBS. Matt, you are unmuted. Go right ahead.
Thanks, Nora. Thanks, Governor and Secretaries. This is sort of a numbers question, not necessarily a math question, so apologies to Dr. Grace for that. But can you walk us through what's happening on these days when we're seeing the 190s and the 200s as opposed to the 65s or the 70s? Is that a result of a rapid response by the Department of Health or the Environment Department? Just what's going on those days when we go from a seemingly very low number to something in the hundreds?
All right, so Matt, if I was, and I'm not, a paranoid person, I would assume that you overheard a conversation I just had with Dr. Grace and my team yesterday and then today again in my office, because I want to know, can we pinpoint what is occurring when you're in the 90s or the low hundreds, and then you're at 200 and 200, I'm averaging, for a couple of days in a row, and then a drop again. And that's one of the reasons that the positivity rates, we do it two ways. You saw the per 100,000, so that we can really look at this county level data and make decisions. And you know that I often talk about positivity rates as they relate to testing. So I can see, even if you've got a large case count, if we did 10,000 tests, if the positivity rate is stable, then I know I'm not having a huge transmission issue, an outbreak issue that we need to analyze further and do something immediately about. I don't think it's a rapid response, because we turn to that rapid response as soon as we get it. Your question might be like today, in our numbers of the 190, 30 of them are from a detention center in Luna County. So where you've got a high-risk issue, like a detention center or a jail or a prison or a nursing home, we know that spread is fast. You get one case, we can expect that we're going to have more cases exponentially. But I am asking, and I want Dr. Grace to give you more information, are we seeing something? Are people traveling more? Is it getting groceries? Is it getting medical care on Mondays or Tuesdays? Are we seeing a pattern? And it's tough to figure that out, because it means looking at mobility data, looking at mask wearing in different communities, and I have been wanting to get my finger on the pulse of exactly that issue. So I'll have Dr. Grace talk about some of the analytical tools. It's not enough to thwart where we are on our averages, but it is something I pay attention to, because I don't think we want to see, I know we don't. I don't want to see both these bumps, and I know that we want to be as a state heading into the winter and schools at that 100 or so cases per day, and getting to the lowest possible point below even the gating criteria for cases per 100,000, because that means that you're holding your readiness and building your readiness moving forward. Go ahead, Dr. Grace.
So thanks, Governor, for asking me to look into this in depth yesterday, because now I have some information to answer the question. First thing, Matt, is if you go into any website that gives really good data, you see this continuous sawtooth pattern of higher case counts Monday through Friday and lower ones Saturday, Sunday. So that's something to always remember. It's why we use a 7-day rolling average, so that we always have 2 weekend days in there. Otherwise, we'd have a lot more variability in the way we report. But the daily case counts, we report daily. Second is, the governor's exactly right that we do have outbreaks from time to time, like the detention center facility in Luna County. And I did forget to say earlier that for the purposes of school reopenings and that red, yellow, green map, we take out detainees in facilities. We still count staff cases, but we don't count the folks who are detained, because they're detained. And so, but in other data and daily case reports, those folks are in. Third, and particular to this week and your question, is we rely to stay sane and efficient on having automated data transfer from our 2 in-state labs, TRICOR and the State Lab Division. That has to happen electronically. We can't handle 5,000 test results a day without electronic. We do have out-of-state labs that fax us, although we're really honing down and requiring electronic transfer. And we did this week have some issues earlier in the week on the low case count days with the electronic data transfer. That's been fixed, but any kind of automated system like that will have some downtime. And unfortunately, if the EPI does not get all the cases they need by first thing in the morning, they can't go out and verify all those cases, and they have to verify those cases to report them to you all. So there's sometimes catch up. The last thing that I look at that really helps me a lot, because I confess that I peek every day at the daily case counts, but I try not to look too much at them. But if I do see this kind of variability, I look at our test positivity rates. And if they're staying constant, that makes me more confident that we're not on the eve of a bigger outbreak. Because if we were seeing evidence of a more rapid spread across New Mexico, and this erratic data was a precursor to that, that test positivity rate would start to drift upwards. And so we're not seeing that. So for now, that's the number I look at second to get a sense of where we are and whether how I should interpret that variation. But we're on it, and we're looking at that every day, and there's some attention being paid right now to the interfaces to make sure that we have a a backup plan or an alternative interface in the event this happens again. So thank you.
Thank you, Matt. Thank you, Dr. Grace. So a multitude of factors that we're looking at. I just want to make sure we sum it up. While we have an anomaly that we tied to the testing reporting over a weekend, typically you do have lower cases on weekends and then higher cases later. And so, and particularly when you end up with a doubling, I think that our medical advisory team can continue to look at that a little deeper, because I agree with Dr. Grace. I absolutely want to know the case numbers every day, and I want as much information about the why and the hows as possible. And I know that our answers are too long, but for people who, and thank you, who can stay with us the whole time, this is really complicated work. And part of the problem at the federal level is they try to say it's not complicated, don't be afraid of it, the virus isn't a problem, it'll just magically disappear, you don't have to worry about testing. No, you have to worry about all of it. And then they make decisions about private lab partners, or they frankly interfere in the reliability of testing supplies. So they leave states like ours having to figure out as many strategies to keep things moving as possible. And not all of our out-of-state partners are required to meet the same strict standards for reporting information, having it all done electronically, being digitized, all of it. I mean, it's actually a little shocking to me, and that some states have very poor partnerships with the private sector. And so they operate in totally different worlds and totally different systems. That's why you need a national strategy. But I think your question should be continued to ask. I think you should ask it again. And I want more information, and I want the Matt to really help us, because that's how we get our arms around the virus. What is happening? Where is it happening? Why is it happening? And that's how we're going to do well through the winter until we get a vaccine. So I just really wanted to highlight, that would have been my question if I was with the press.
Thank you, Governor. Next, I'll go to Dan Boyd with the Albuquerque Journal. Dan, you're unmuted. Go right ahead.
Yeah, good afternoon. Thank you for the opportunity. I just wanted to clarify a couple things about the school plan that Secretary Stewart talked about. First, it is my understanding that if they are allowed to go back under the hybrid model, that would be just for elementary age students. Wanted to see if you could expand on that, and what's the rationale between only allowing the younger students to go back. And secondly, with kind of that gating criteria based on county, you know, what would happen if a county kind of fell out of those target criteria or kind of into the criteria? Would they have to pause in-person learning? Thank you.
Yeah, so Dan, thank you. I'm going to go right to Secretary Stewart, but I'm going to remind everyone watching of a couple of things. One, the magic about elementary age kids and those schools is those are the kids that gain the most by being in person. That's not to say that in person isn't still preferred for all students at all education levels. And they're also the most difficult to keep engaged in the way that you need them to for online distance learning. I mean, think about, I'm living through that right now. A kindergartner, that's their first exposure to you know, education, arguably, a little bit of early childhood education, and it's really tough. So focusing on our students' higher risk in terms of outcomes, need that more in-person experience, and it's a place for us to introduce risk slowly so that you're not doing all the schools at once. And very important point about what happens. We will have a county go into the green potentially tomorrow, and somebody will go yellow or red. So that's why we're doing this at 2 weeks at a time by making decisions, because then you can see that you've got trends that we can rely on for effective decision making. And that's exactly why the gating criteria looks at those rolling averages, and it's exactly why they're going to look at the schools in particular over 2 week periods of time. Secretary Stewart, anything you want to add?
Well, thank you, Governor, but I think you summed it up quite well. One thing I would add, and Dr. Grace mentioned this a little bit earlier in the press conference, was this idea that we don't want to get into a situation where a school is at 7.99 cases per 100,000, one day, and then the next day they're at 8.01, and they're closing, opening. Schools can't operate effectively that way, so that's why we have the longer time period to look at it, and we'll be establishing some thresholds about when we think it absolutely is a bright red flag where we do need to close specifically because there's an outbreak or we've seen a massive jump. But really, we need to make sure that the way we look at it on that trend line allows schools to operate effectively, allows schools to communicate to families effectively, and allow for that planning. We know how difficult that's been as we've had to respond to the surges and waning of the virus. The certainty and planning around that has been, it's always incredibly challenging. COVID doesn't allow us to plan as far ahead as we would normally like. But that is the way we'll operationalize it on that longer trend, so schools aren't being yo-yoed back and forth.
Yeah, and just a couple other things, because it's a great question, Dan. Love math questions. In the modeling, if you send half the students back, you have half the potential spread, and with that being exponential, it makes a significant difference. We want to be cautious. We want to try this out and make sure it's working so we can slowly expand. But more importantly than that, it isn't just any 50% of grades. When Lanel built their very sophisticated model, they put an increase in activities with friends and outside the home and school in for middle schoolers, and a much bigger increase in the model for high school students, who can drive and are far more independent. And so we wanted to pick that population that gave us the absolute best shot at success initially. And then finally, on do we have numbers? I already said we're not going to use the numbers to get in as the numbers to get out, because we want this to be stable. It's really important. And while we probably will come up with something, and I have no idea what the numbers will be, like if it gets this bad or the testing, positivity is that high or the cases are that high, I don't think that's going to be as relevant. I think everyone's going to know if we have a problem. First, we'll see classroom school closures and multiple school closures, and it'll be very clear that things are getting out of control early on. And I think on the one hand, we will come up with something that guides us, but I wouldn't want to be tied to those numbers, because I want our, epidemiologists and superintendents and school boards to really have that ability to read the signs and make quicker decisions if pulling back needs to be done. So, thank you.
Quick recap. It's how you get to be approved to do in-person learning. It's not how you get out. We deal with specific outbreak data and related issues to make those decisions. We're still modeling for the future, and I appreciate Dr. Grace really honing in on the fact that older students have their own set of challenges and risks, and that's been primarily the problem at universities. And there was a university student who said, for the first time ever, students are getting to leave home and have a little independence, and then they're told, don't leave your dorm room, don't meet anybody else, don't walk around the campus, and they can't help themselves. That's been part of the problem in the university design is older students are more mobile and are exercising that level of independence and freedom, and they're higher risk as a result. Next question.
Thank you, Governor. Next, I'll go to Julia Goldberg with the Santa Fe Reporter. Julia, you are unmuted. Go right ahead.
Very clear.
Thank you, Nora. Two questions. Governor, you said that 24 school districts have opted to postpone in-person learning until next semester. Is there information about how many school districts have their plans approved and in fact are starting in-person learning after Labor Day? And my second question related to the vaccination information Dr. Grace shared. It's my, recollection at least, that the number of people who are exempting their children from vaccinations in New Mexico has increased significantly over the last decade. I want to say maybe 60%. I'm wondering if you anticipate challenges, actually, rather than, not rather than anything. Do you anticipate any challenges in terms of the COVID-19 vaccination when it's available? Thank you.
All right, so I'm going to go to Secretary Stewart, but yes, everyone had to provide a plan. and that we have an approval process, and I want the secretary to talk about that. They're very detailed, and we've been collecting those, and I'm sure he can provide something also separate to the press conference, make sure that you've got access to that. And then I want to make sure that Dr. Scrace talks about vaccines, and there's been no decision that I'm aware of anywhere that says a jurisdiction or a state is going to mandate COVID for school-age kids, but that will, I am sure, be a debate that occurs not just in this country, but is a debate that's going to occur in every country. We're going to follow the priority populations for flu. That I'm very confident about because we know how to do it. We've got a great degree of compliance. It's related to how you get into the Medicaid program, any number of things. So doctors, nurses, high-risk populations in nursing homes, their workers, educators, et cetera. Those are those priority populations for flu. And then there are mandatory childhood vaccinations. And the reason you had Dr. Scrace push out, we need you to get your flu vaccine and we need you to get your mandatory vaccines because we are seeing those declines where folks are opting out and without being engaged in a vaccine debate. This I know unequivocally. The fewer individuals that get flu vaccine that are not part of that priority or mandatory populations in the state. And if there's not confidence in the COVID vaccines, we will not get the kind of opportunities to protect our frontline healthcare workers and prevent transmission and the number of deaths, the mortality rate issues, which for a state like New Mexico are considerable among our high-risk populations. I mean, half of all infected pregnant women in the United States are Hispanic. And so the risks are incredible. I think this is going to be a growing public policy debate, and New Mexico will participate as meaningfully as we can. My hope is that we'll build more vaccine confidence in New Mexicans, both for the current childhood required vaccines, flu vaccine, and the COVID vaccine. But I'm prepared to engage directly. Secretary Stewart, you want to talk about the plans real quick, and then we'll go to Dr. Scrace.
Absolutely. Thank you, Governor. Thanks for the question, Julia. On the districts that have already indicated, that's both districts and charter schools that have indicated that they are staying in remote learning beyond September 8th. Not all of them have suggested that they're going to stay for the entire semester. I know Albuquerque did take a vote to extend theirs for the entire semester. Others have had different lengths of time, 9 weeks, first academic quarter, et cetera. On the districts who have applied and been approved with their PED-approved plan, this has been an ongoing process. We've been going back and forth. We have a rubric that spans the instruction, social emotional learning, and the family and community engagement, and we've set a pretty high bar for all districts to make sure that they're able to meet the top levels of all of those criteria in order to get an approved plan. And so we go back and forth, and we're on iteration 3 with most districts and charter schools around the state. So far, about a third of our state charters, I believe 17 out of 52 at last count, have already gotten approval, and we know we have a lot more who are pretty close to approval of their plan. And then a little less than half of the school districts, 38 out of the 89 at last count, have had their plan approved. And again, we have a number who are pretty close and have just a few more areas to work on. But the general idea is, especially coming off of the spring where we had to do this on a dime and make all of these changes, being able to put in place an even higher bar for what instruction looks like, whether you're working remotely in the hybrid model or full reentry, so that we can make sure that this year is not just a year where we're treating it as a lost year and kind of biding our time until COVID passes. We know that we have to be attending to the academic and social needs of our kids, no matter what the conditions are. So we did set that high bar, and we certainly expect over the course of the rest of this week and next week that many of those who are very close and just have a few items that they're working on will get those submitted and get that approval process.
Yeah, yes, and Julia, great question about vaccine adoption. I think the question is, will there be challenges? I think absolutely yes. There will absolutely be challenges for sure. And there's some things we know and things we don't know. So for example, we don't know yet what the efficacy rate is of any of these vaccines, like what percent of people who get the vaccine get immunity and will not get COVID. And we don't know what the side effects are. So if we have a vaccine that gives 100% of people immunity with no side effects, then we're going to have an easier time convincing people to get the vaccine. And of course, the converse is also true. Another piece of good news for us, I think in New Mexico or anywhere, is you don't need 100% of people to get the vaccine to develop the herd immunity. You need to kind of move back into some sort of normal way of societal living. And so that's a good thing, because that gives us some room for some people, not most people, to do that, to opt out. And then lastly, and this is, if you're a fan of dystopian pandemic movies of horrible futures where society is completely ruined by pandemics, a lot of those movies have people walking around with armbands, who've been vaccinated and they have access to real life, and people who don't have the armbands don't. We do not want to go to that kind of system at all. And so I think the best solution is, and DOH is also working on this, and you saw a slide today, a public information and campaign really to get people enthusiastic about the vaccine and get them to want to get it. And so I think in all those things, we'll know more as time goes on, and I think it's up to state government and our provider community to communicate effectively to all of us the facts about the vaccine, whether or not we each would benefit. I can tell you I'm getting it. I've got some risk factors myself, and I want to get the vaccine, but I also want to get it after I know about efficacy and side effects as well. So we'll be monitoring that. We'll keep you informed on that. Big topic of interest, and will be probably till next summer, and we'll let you know how we're doing. Thank you.
Thanks. And for everyone just watching, Dr. Grace gave an extreme hypothetical example of a science fiction environment, because some people tune in right then, and we're gonna continue to do sound public health determinations about who should be vaccinated, who has to be vaccinated, and engage in public government credibility about the safety and efficacy of this vaccine. But yes, I think there will be challenges, and there are far too many conspiracy theories, in my opinion, about vaccines and about what's happening, and it makes it really difficult for a layperson to navigate through all of it. So I do appreciate, Julia, that you gave us a chance to talk more about what that might look like. Next question, Nora.
Thank you, Governor. Next, I'll go to Chris McKee with KRQE. Chris, you are unmuted. Go right ahead.
Thank you very much. I wanted to ask a question about schools. Secretary Stewart, of course, had mentioned the need for maximizing the amount of in-person learning around the state. APS, of course, isn't alone in this decision to postpone school, but of course it is the state's largest school district making the decision to go to all digital learning through December. We just have heard from a lot of parents around the Albuquerque metro area who are faced with that difficult decision of going to work or staying home and helping watch their kids learn. I'm wondering at all, even though these districts are allowed to make this decision, do you, at the state level, disagree with the decision that these districts have made, or some districts have made, to go to all in-person learning through December?
I'm going to get the Secretary Stewart, but Chris, these are really hard decisions. Think about where the school boards are. They're in the same position, frankly, I find myself in every day. I have educators who are clearly in the high-risk group. I know this virus is deadly. I know it can be deadly. I know that there's real transmission in Albuquerque. I know that I have students that have any number of also healthcare issues that give me great trepidation. And what we're seeing around the country is some, all too often, just the examples of where it's just not working. And then you have to manage it all, in person and distance learning. It is really tough. And so I do ask this of all of our viewers and of New Mexicans. These are not easy decisions. If they were easy, we'd have a very singular playbook. Everybody would adhere to it to the best of their ability with some local opportunity, because everyone knows school boards have and should have a ton of independence in meeting the educational needs of their constituents and their communities. We have an interesting hybrid educational system in New Mexico that I think warrants maintaining. These are hard decisions. They're hard for us too. You pointed out something we haven't talked enough about, which is why we have other cabinet secretaries, and maybe we need to bring Secretary Gorginski to talk about how we're getting more child care centers up, and there's challenges there with enough funding and pay. But they're doing an incredible job. They really are the heroes in so much of what we're doing right in New Mexico. Look no further than our child care workers and centers, who have been amazing. And they did this early, when it was very difficult for us to talk about how we mitigate risk effectively and how confident we were about our abilities to do that. I mean, they took incredible risk. Parents are in an incredibly challenging environment. Not all workers are able to telecommute. If you telecommute and you're supporting your student, your child, it's not easy, and it requires real attention. I don't care what grade it is, which means you cannot work. That creates challenges for that employer and that employee. This pandemic is awful, and anyone anywhere in the world that suggests that this has been easy is minimizing the real issues related to this virus and this pandemic. And so there are no easy answers here, Chris, and I want to be earnest about that, because I think people want us to give them a great deal of confidence that it's going to get easier. I think there will continue to be challenges. I think that parents and families and educators should expect us to come up with as many ideas, models, and supports that address as many of their concerns as possible, and that New Mexicans have an obligation to lower the positivity rates and the transmission rates of this virus, so that we can introduce more opportunities for districts like the Albuquerque public school system, so they can have more confidence about these high-risk decisions that they have to make. And so I just really wanted to lay that out there, and I don't agree or disagree. I appreciate that they took on this challenge, and that they were decisive given the circumstances that they were presented with. And I have no doubt that they have parents and constituents that they are responding to that are very disappointed in that decision. We hear from those very same individuals who have valid complaints and concerns. They're valid. And I appreciate that they were decisive. But for me to say that they made the right or the wrong decision, my job is to say you can't do something that's so unsafe that I know people will be infected immediately and that we're going to have more mortality issues in the state. My job is to tell you how to mitigate risk and transmission. My job is to make sure that the Secretary of Public Education has as many tools and resources to provide a quality education through our direct education partners as possible. But it's not going to be easy. Secretary Stewart.
Thank you, and I agree with what was just said. So I'll just add a little bit here on, it's one thing where we're approving plans that look good on paper, but it can't just stop there. Both we and the district have a responsibility to make sure that you're able to operationalize those plans. When you're talking about a district like Albuquerque, operationalizing them at that scale. And then there's the other factor of building enough buy-in and having that confidence amongst your community that the plan can be done safely and they're ready to bring their students back. And it's an incredibly complex piece of work. And like the governor said, our school board members are in incredibly tough positions. Our superintendents are in incredibly tough positions having to navigate through this. And so that's why we're not forcing a district to bring students back if they can't guarantee on their own that they're able to operationalize that plan or that they have the community ready to bring students back into the school system at the level that they need to operate an effective program. So putting a lot of effort into doing something safely and doing it very well makes a lot of sense, and we don't want to, again, put people into a premature position where we might be exposing people to conditions that aren't yet ready for in-person learning before that time is appropriate.
Right, Nora.
Thank you, Governor and Secretary. Next, we'll go to Algernon Damaso with the Las Cruces Sun News. Algernon, you're unmuted. Go right ahead.
Thank you, Governor and Secretaries. I have a question about PPE supplies. We are currently meeting our gating criteria as far as hospital systems having adequate supplies of PPE. As we reopen more activities, as some schools perhaps resume in-person learning with PPE, restaurants and churches admit more customers indoors, and as indeed we move towards the fall and winter when more activity will be indoors, I'm wondering if a factor in the modeling is the supply chain and whether commercial markets are able to provide people with steady supplies of PPE as the pressure for that increases.
It's an incredibly good and important question, so thank you. It's not in the great gating criteria directly, and Dr. Scrace may disagree with how I communicate this. But when you look at a hospital capacity, it's not just having enough beds and providers and ventilators, which we're very clear on the gating criteria. But if nobody can show up because you've got no masks, no gowns, no gloves, and no one's protected, then you have a hospital capacity issue, which is your point. So I do think it's included indirectly, and maybe that's the best way to describe that in the gating criteria. But we do track PPE. So we have a logistics system that evaluates how much we have, where is it, how many of the medical grade, right, that's an N95, a respirator mask, specifically fitted for a healthcare worker, and shields to make sure that, you know, they are completely protected from the patient's droplets, particularly when it's a known patient with COVID. All of that has to be a priority. We are also now working with school districts. You know, and this is not to say that they have to do this on their own. Schools got some funding, to your point, I think, about getting PPE. And just an easy mask to identify with is a surgical mask. Those are now more available. They would meet the layering requirements for educators. We're not requiring that students wear those, although you're seeing that there's lots of folks that are advertising to families that you can buy a pack of disposable masks for school-age students and children. We feel confident that those are available, and we feel pretty confident that a non-respirator type mask but would be an effective mask, something called the KN95, that those are all available. I want to give you a couple of caveats. That as schools open around the country, and as restaurants and other businesses like that are purchasing PPE, we have a two-part problem. If there is insufficient supply to meet the current demands, the prices go up, which is hugely problematic. Frankly, for me, it's outrageous. And I'm not suggesting that a lot of these companies are from overseas who I think took real advantage of this country and other countries. And it creates confidence problems in making sure that you get enough in. I think we have to wait and see, but today, with the amount of PPE the state has in its stockpile, and the system that we use to evaluate Burn rates, where is it? Who do we give it to? How much is left and how much is coming in? I have a high degree of confidence that New Mexico's in a very good spot, including with needing additional supplies for our education system.
Yeah. Two things. One, the governor's right that we do have a metric about PPE, but it's been doing very well for a very long time, but it does only focus on our 7 hospital systems that are our hub hospitals, because that's where we have most of our ICU beds. Also, of course, you need PPE now, full PPE, to take specimens and swabs, and so the state uses a lot of PPE with daily testing. But again, I think the supply chain in the market has been pretty responsive in 2 ways. One is the big manufacturers like 3M and others have effectively ramped up production in a short period of time. And then we have techniques that we use quite actively in New Mexico. We're one of the leaders in the country where we refurbish the N95 masks by spraying them with hydrogen peroxide. And so we're over 20,000 of those, and our delivery systems are using that. They take those masks and they put it in their stockpile. So if we do have a surge, we can use it. And then the last thing about school reopening is that the kind of personal protective equipment that the vast majority of teachers and students will be using are just multi-layer cloth masks. And so I think, well, I think that we will want to have a more than adequate supply if kids forget to bring masks or there are other issues. You know, there's been, and if you go on Amazon, there are innumerable opportunities to buy masks now in large quantities, and even the surgical and procedure masks that I often wear when I'm out and about are available now by the box at a reasonably low price. And the state, I heard the other day, is able to, you know, buy like 500,000 of those at 12 cents a mask. So I think we're set there. In closing, I would just say I wish the supply chain had responded as efficiently with lab testing equipment as it had with the masks and other PPE, because we still struggle day to day to make sure we have everything we need to run tests and get those done.
And the state correction system can also make masks. So I feel I have a very high degree of confidence that we are well prepared even for a tough winter. And we don't want that, but we have to be prepared for that, that we're going to have sufficient PPE. Next question.
Thank you, Governor. Next, we'll go to Brittany Costello with KOB. Brittany, you are unmuted. Go right ahead. Brittany, do we have you there?
Sorry, I think I muted myself again. Yes, my question is surrounding testing. I know there was some confusion this week with CDC recommendations. Initially, them saying, okay, if you've been in contact with a positive case, you don't necessarily need to get tested unless you're showing symptoms. Testing has been a big focus for our state, so I'm just wondering if you guys can clarify that.
Well, I'm going to go to your actual question. Can I clarify that? I don't think so. I don't understand what is going on with the CDC and the federal government except to say this. There is not a strategy, and I do not want to believe what appears to be fairly evident given a New York Times article and the CDC walking back the changes to their guidelines, basically saying, you know, you don't test asymptomatic people. In a nutshell, that was basically their guidance, only symptomatic. We know asymptomatic, we know this. We know this as a state based on our own data and our own healthcare experts and epidemiologists that we have asymptomatic populations with COVID. We also know that an asymptomatic individual, we know that they can transmit it because their household gets COVID. We know this beyond any doubt. I think because there was not a testing strategy, and I believe, without evidence to the contrary, that the notion that the president felt that too many tests were resulting in too many cases, that there was likely a sense that you should encourage states to only do symptomatic individuals, and it's also a signal to the testing manufacturers that they might have some time to catch up getting their supplies ramped up, because they are really difficult to come by still. That is the majority of what my job, we all have very specific roles to make sure the state can keep managing productively in a COVID world, and that's one of my jobs, is to chase testing supplies. That's what I think is going on, and I find it appalling, because if we don't have public confidence in what we're doing, it's outrageous. And then the second thing that's really disturbing about this is that you don't manage transmission and you don't stop outbreaks, and that you allow whole families then to potentially be infected. And that means that we would have more New Mexicans and more Americans who would lose their lives. I find it really, it's reprehensible that we would create yet another wedge in our public health response in this country. I'll end with, I appreciate that leaders in the CDC are now saying, let's clarify. And I appreciate that, journalists are doing investigatory reporting and trying to really get at the bottom of what's going on. And I'm grateful for that. But I can't tell you exactly how that came about or why, but we're going to continue. So testing everyone, and then Dr. Grace is going to take a deep breath and then want to clarify. There is not a New Mexican who cannot get a COVID test. There is not a New Mexican who will be charged for getting a COVID test. New Mexico does not have 2 million COVID tests available, and that means all the supplies I need to do it. I don't have the people to swab you. I don't have all the things I would need to tell you whether you've got COVID. So we have to then create a strategy that finds the virus and protects other New Mexicans and gives people with COVID sound, sage, immediate advice about self-isolation. That means if you're symptomatic, I need you to get tested immediately. We want you tested. And our private partners really focus to the highest degree they can on that population, because that requires more in-depth discussions about things to look out for in assessing someone's medical risk while you're in line. If you're having respiratory issues, we want you to see a provider immediately. The Department of Health focuses on asymptomatic individuals who have been in close contact with someone who's infected, because we're chasing the virus. These are the populations that we want to come to our sites. We have surveillance strategies for corrections and child care workers and essential businesses. If we have a rapid response, we have 30 rapid responses right now are restaurants. I think 15, half of those cases are one McDonald's in Ruidoso. We have to go in, test everybody in that business, and make sure it's going to be safe to operate in the near future, right? So we're going to continue to marshal, and you heard that we're going to do some educator and education testing surveillance strategies. All of that's going to stay in New Mexico. So I want to make sure that Dr. Grace knows that I can learn a thing or two, and I shouldn't be so flip, but we do have robust debates about what's the best way to protect New Mexico, so that I can make a policy person as a non-medical professional, that I use the advice and the strategies that are determined by medical professionals. So, Dr. Grace, did I get any of that wrong that you want to clarify?
Not
We're
at
good.
all.
All right. We can test everyone and anyone that needs or wants a test. We are not asking you to do that. It would overwhelm our systems. We disagree with the first part of the CDC advice that asymptomatic individuals do not need to get tested. Next question.
Do you have a couple numbers?
Yeah.
Can I throw them out
yeah,
there?
throw them out.
Real quickly, in the state of New Mexico over the past couple months, about somewhere between a third and a half of our cases have been asymptomatic. So that's a really important factor. This myth that the more tests you do, the more cases you find is partially true, but it's not a one-to-one ratio. In our modeling and work with Lionel again suggests that it's about a 1 to 15. So because symptomatic people come forth, if we have 5,000 tests a day now and find 100 cases, our modeling would suggest if we did another 10,000, if we did another 5,000 a day, 10,000 a day, it would only yield something like 7 to 10 more cases. So it's not that thing everyone fear. And lastly, CNN sort of kind of gave some kudos to New Mexico and credited our success to science, common sense, and leadership. And I think, you know, if you have contact with someone with an active COVID infection, I think it's just plain common sense.
Get tested.
Do you want to get tested?
Yep. Thank you, Dr. Grace.
Thank you, Governor. Next, we'll go to Morgan Lee with the AP. Morgan, you're unmuted. Go right ahead.
Kudos to New Mexico and credited our success to science, common sense.
Hi, Governor, secretaries. Thanks for taking my call. Just real quickly, state museums, will they reopen on Saturday, the ones that are not hands-on? And what about places like Meow Wolf or escape rooms? Another question is this county-by-county scheme for giving the green light for in-class learning, is that something you're entertaining to apply to other reopening of the economy issues, like for businesses? And then to circle back on a previous question, you know, you said, you and Secretary Ryan said that you're going to preserve this opportunity to opt for remote learning. At what point might you say to schools that are in the green zone that they have to provide, you know, some opportunity for some students to return to classes, given what you said about, you know, young learners and how difficult it is to be online? Thanks.
Morgan, I might have to have you tell me about the middle question again, but let's do the last question. You know, mandating in-person learning for all ages, which we know is that's the education system we embrace, and we know that it should be delivering the kind of outcomes that New Mexico is working to achieve for every single student, right? We're focused on student success. That's without a pandemic. I believe that any state, including this one, that would tell educators that they are required in a school district to come back to in-person learning without a vaccine does not take into the consideration that I can't guarantee you will not get this virus. I mean, that's what people should expect if I was going to make that mandate. That if I invite in the safest possible way to begin in-person learning, and that's what we've said, we're inviting strict standards, strict protocols, strict PPE, surveillance testing standards, rapid response, plans from the districts, and they got to meet distance learning. That the only way you would mandate that you got to come back is if I could promise that every family, every student, and every educator, and that means everyone in the public education system, will not get, by virtue of going to school, COVID. Well, that's impossible. And I cannot do that. I can, to a high degree, commit to that when there's a vaccine, because you have a choice then. You can be vaccinated against those risks. All right, so that's why we don't do it in reverse, even though we know that there are implications and impacts to student outcomes. All right, so that's that one. Meow Wolf and the escape rooms, I was trying to think what, are not included in the museum opportunity at 25% capacity. Again, our goals are to get everything open as we can, but we are living in a COVID world, so you introduce risk slowly and surely, and we take recommendations from the Economic Recovery Council. Museums that are ready, they are staffed up and cleaned and feel like they can have the placements for where people are distanced, right, 6 feet, and all of the other things they're required to do, that they have a process for payment and admissions and all of that and metering. They could open up on Saturday. Morgan, I don't know how many of them, both state-run or privately, are ready to do that on Saturday, but I would expect folks to either be able to do that or shortly thereafter be able to announce that they're ready to take visitors.
third one is, we need the county level criteria for anything other than nursing home visitation in school.
That's what it was. And the Dr. Scrace is not going to answer that because he knows that I know the answer, and that is no. And the reason is we've been talking about that people travel between the businesses, and that data is so specific to just those two areas where we want to really monitor that risk and know what's happening, that it would be imprudent data in terms of figuring out what we do. The only caveat wasn't county. When we had huge outbreaks in the Northwest, remember we delayed some of their economic opening using a like strategy, not exactly, but a like strategy for figuring out readiness for in-person learning for schools. We would be making decisions about opening and closing businesses every day, and business predictability would be completely unfair and ineffective, and I wouldn't be able, nor would the map be able to really understand what the data is telling us and what's likely to be occurring. So you will not see us use that county. We'll continue to do that on a statewide basis and then focusing on regions. But as you're aware, we know what's going on at the zip code level, and that data is important and valuable for certain high-risk activities in terms of our decision-making. Schools, nursing home visits as examples. Next question.
Thank you, Governor. We're coming up on 5 o'clock here. We have a few more questions. Next, we'll go to Michael Gerstein with the Santa Fe New Mexican. Michael, you are unmuted. Go right ahead.
In terms of our decision-making.
Hi, Governor. Thanks for taking the question.
Michael, I'm sorry. If you could turn down your audio in the background. Thank you so much.
Sorry about that. You mentioned earlier that scientists are predicting a possible resurgence this fall or winter. I was hoping you could go into a little more detail about what that looks like specifically for New Mexico and how the state at large is trying to prepare for that.
I'm going to do a couple of things and then give it over to Dr. Scrace. I mean, I think that basically the scientific and public health community at the national level is doing what they do best, which is they're looking at previous virus activity and information. Okay, this is a new virus, so we're learning about it as we go, but they use that flu modeling as predictive behavior and virus modeling as predictive behavior. And there's been, I think, some confusing terminology out there. We're in a second wave. Are we? And maybe New Mexico, if you looked at the early spike in April and then later in July, was or May and July, where those are two, first wave, second wave. Is the fall really going to be that bad? And basically, you know, I am at least using it for policymaking in a predictive way. I'm going to, even though our cases have stabilized, we're meeting our gating criteria, I'm not going to lower the amount of testing we should try to adhere to. We're going to keep telling people to wear masks and do social distancing and good public health behaviors, washing hands, and not to go out. I mean, the less you travel, the more control we have over eliminating to the highest degree risk of transmission. So I do want Dr. Scrace to talk about how they do this virus modeling, but I believe in large part it's what we typically know about cold and flu season in the winter months, and that more of our activities are indoors, right? And so that you have higher rates of transmission. And I believe that those are the cornerstone or foundational aspects of how they're making those predictions. One last thing about that you might have been noticing, Michael, is that because we're pushing out internationally in addressing this pandemic, better public health measures, we're seeing a lower, in the southern hemisphere, we're seeing lower flu numbers than we typically do, and we believe so far, at least the public health experts believe that the mask wearing, social distancing, and the stay-at-home orders have largely contributed to reducing flu, and we want that. That will help New Mexico, and that's how we're preparing. Masks, social distancing, please don't go out, slow, steady, pragmatic risk-taking that's manageable, that protects our healthcare workers and protects transmission to all New Mexico families. That's the best we can do, and we will keep doing that. Dr. Scrace.
Thanks, Governor. And the governor's really right on about almost all of these points, and I'm just going to add some. You know, this is based on typical viral activity, influenza, even coronavirus. The 4 common coronaviruses that cause colds peak in January, February timeframe. We time our influenza vaccine to cover people through that peak. We don't know exactly why that's true, but you listed a couple things that could be part of it. People indoors more. You know, they have more contact with each other when they are indoors. But some people think maybe the effect of the lower temperatures compromises the respiratory system. That's particularly true in people with asthma and emphysema and things like that already. I see that in my clinical practice, and I have patients with such bad respiratory illnesses. I basically tell them to self-quarantine for 3 months during the winter months to protect themselves from infections. On the good side, mobility is lower in the winter because people aren't out and about. It peaks in the summer, it's low in the winter. And so far, the best predictor of coronavirus cases in New Mexico, or the tightest mathematical correlation anyway, is with general mobility of the population. So that could work in our favor. And lastly, the point the governor made about the Southern Hemisphere, I'm counting on having some good data out of countries in the Southern Hemisphere who are in the middle of or coming out of winter right now about what they saw, what they learned, that we'll be able to build into our modeling going forward. And so all of those things, I think, add up to a logical conclusion that this is going to be a rougher time in the winter. And because it's a novel coronavirus and new, we just don't have data to know about that yet. But hopefully Australia and South America and Southern Africa will have information. Thank you.
Thank you, Governor and Secretary. Next, we'll go to Matthew Reichbach with New Mexico Political Report. Matt, you are unmuted. Go right ahead.
Yeah, I just have a quick question about the new order. Is the 14-day quarantine for those who travel out of state and then return back, or just those who came from out of state into New Mexico, is that still in place with this new order?
It is still in place, but it's a great opportunity for me to, we are looking at that. There are several states that have relaxed their own quarantine orders very successfully. New York is a good example. There are states that we've mentioned in prior press conferences, although some of them have abandoned this. Alaska, that if you brought in a negative test within 3 days of traveling to that state, then you weren't required to self-quarantine. And that strategy is effective in that people are paying attention, getting tested, have some degree of confidence that when they arrive in your state, they really aren't transmitting COVID. But the problem with the test, it's only good for the day that you took the test. I don't know whether you're in your incubation period. We don't know whether you catch it when you're traveling to a state. But we do feel like there's some room to make some modifications in the quarantine order. And again, I hope that there may be some other things that the Matt and my public health professionals will give me a range of options that, again, slowly introduce risk, but ease on some of these restrictions. 2 reasons. It's not just the economics of what we know is occurring when we don't have tourism and we don't have businesses completely open. No one is unclear about how terrible that environment is here or around the country or around the world. Clear. But the other thing is to prepare for living with this all the way through the distribution of a vaccine, which is basically 9 to 12 months from now. If everything goes right, everything, we have to make those, we have to be able to pragmatically make some adjustments. So I'm hoping even by next week at the next press conference, we have more optimism and productive changes to share with you. Again, the North Star here, dimmer switch, not too much so that we harm the opportunities for in-person learning for our elementary schools that would be eligible to do in-person learning in the state. So and nursing home visits. Folks know that they can do that. They're making appointments. They're building the plexiglass visitation devices to pull the plug because we did too much risk all at once and it overwhelmed us. It would be so unfair to these populations that have waited so long and deserve that they get the opportunities to do these new risks first. I do not want to do that. But I'm feeling pretty good. And New Mexico should feel really good. So again, slow, steady, but I think more good news is coming.
And we'll go to our last question from Brandon Evans with KRQE. Brandon, you're unmuted. Go right ahead.
Well, thank you, Governor and Secretaries, for providing these updates. I know not every state is able to get these from their state leaders on a regular basis in the depth and detail that you guys do it, so thank you for that. My question is about the gating criteria, 7 out of 8 categories that we meet. Not meeting it when it comes to contact tracing. Dr. Grace briefly talked about taking the data from 2 different databases. Can you explain why we're not meeting the contact tracing gating criteria?
Yes, we can, and I'll have Dr. Grace do a little bit more of it. So I want to do, and I hope, Dr. Grace, I don't drive you right over the edge, but when you're not in a pandemic and you're getting infectious disease reports from a lab, you're getting a handful at a time. And that system is in a very sophisticated public health epidemiology database that is designed both to do patient protection and privacy, but also to make sure that we know what's going on in terms of infectious disease. In the pandemic, where you could get 400 of those in a day, really tough. 2, only the New Mexico labs, and I'm going to minimize some of our partners, and so this is an apology to our hospitals and to New Mexico Pathology Associates in Roswell and to New Mexico State, who's gearing up to do more laboratory test results for us. We got a lot of private partners who all have the ability to communicate with us through an electronic system that meets our standards of delivery of information. So TriCore and the New Mexico State Lab can do that. A lot of other folks, so if you go to CVS to get a test and they send it somewhere, I don't get that information, or Indian Health Service, I don't always get that information in a format that loads into that database in the way that I need it to. That can cause a delay. 2, we use a different database initially to do all the contact tracing so that you get a positive case. We do the initial interview, or we call an investigation, gets transferred over, gets put into another database. Those are finally merged. I would like to tell you, and I merged as a soft term for the technical work that's gone on to make sure that we don't erode an epidemiological, safe, secure system that meets all the federal and state requirements, but allows contact tracers to have access to information in a timely manner so that they can talk to individuals who might have been exposed to the virus. That has been incredibly challenging. So I thank the folks both in the private sector and the public sector who have helped us. But I also, it's been a great source of frustration for policymakers, me included, and department leads. But we think that that's largely fixed. And lastly, actually 2 lastlies, when we run out of supplies, then we actually push our tests to other partners. This is a state, frankly, that I think is doing this better than any other state in the nation. We are incredibly flexible and redundant. I know instruments will go down. I know we'll run out of a reagent at the state lab. I know that we'll have a delay in a shipment. I'll know that we'll run out of public health personnel. We'll have guards will get deployed somewhere, firefighters. I mean, we have any number of challenges all the time, every day. And that might mean that you have to move your testing supplies to be run through another laboratory, and they don't talk to us. And we had that issue. We actually had it a couple of times. And another reporter asked us, can you really do these tests? And how long does it take? And I said, we can do them in 24 hours, and that's the gold standard. I want it. Frankly, we have the ability in many circumstances to run tests and tell you in 4 hours. The requirements are 24, no longer than 48. You get into reimbursement problems with us if you can't meet those standards, unless there is a problem, and problems do occur. And we've had a couple of instances where we got some backlogs because we didn't have the right supplies to run them all timely. Then that creates problems with us meeting the hour requirements. The sooner we get to a contact, the better it is. Last, you're giving me an opportunity to make a plug. New Mexicans, please answer your phones. You know, help us. Maybe we wrote it down wrong. Happens. Make sure that you repeat it or ask us to repeat it back to you, and I'll try to make sure that that's the standard every time you're giving information when we do a swab. When we call you, and we do, we text, we call, we have any number of ways to reach you. Call us back, text us back. New Mexicans are not doing that as well as we could. And when you don't call us back and we can't make contact, we don't meet that gating criteria. Because unless people have been contacted and isolated, that's the whole reason you count it as a gating criteria, that I'm not managing the potential spread of the virus. And so those are all the challenges. And Dr. Grace, is there any that I've missed that you want to identify?
Just one.
Okay, all right.
Thanks, Governor. Just a real quick refresher, there's 2 criteria, or 2 measures under this contact tracing criteria. The first is how long it takes us to get a hold of the case. Now that's automatically easier because, one, usually the lab collects the correct spelling of their name and it has their address and their phone number and their birth date. So we have a list of people once we get those positive cases to just call and confirm. From those people, we get the names and sometimes phone numbers and other information of the people they've come in contact with. And that's the second measure, is the time it takes us, still going all the way back to when we got the result, to reach those folks and quarantine them and make sure they don't have contact with others until that we're sure they don't have the virus. So that isolating the cases, we have a target of 24 hours. We're at 20 this week. Quarantining the contacts, target of 36 hours. We're at 47, which is still pretty good. Better, it's a tight target. So that's one thing that we have set a higher bar, if you will, in terms of getting a hold of those people. But we don't, when we call up a case, they don't have ready a digitized list of people with correct contact numbers and everything else. We are adequately staffed to do this. We have enough people to do it, but sometimes, some weeks, people answer their phone on the first ring, or it's an unfamiliar and they don't answer at all. And so I think we're going to always see some variation in it. I'm pretty confident that we're not looking at an adverse trend and that this is headed upwards. It actually was similar last week. And so I think we have it under control, but there are way more variables in getting a hold of the context of the case than there are getting a hold of the case. The case, we get handed a silver platter with the name and number and everything else. The context of that case, that's serious detective work. Thanks.
You got it. So that was the last question, right, Nora? I know this has been a long press conference. They are often. There is a ton of information, and we do want to provide an opportunity for as many New Mexicans, whether it's live while we do the broadcast or later in viewing it, to have as much information as possible. I actually think that that's helping New Mexicans comply and practice good public health modeling and behaviors. The contact tracing plug here at the end is, if you think you've been exposed, or even sometimes you see on social media, this happened at this business, gosh, I was just there and I spent 10 minutes there, call us. Self-isolate. Don't go out, or quarantine yourself. Don't go out. This really helps us until we know whether or not you're at risk, whether you should be tested, what else we can do to support you. Don't be afraid to call us. 2, New Mexicans, please wear your masks and socially distance. We are doing better and better, I can tell by the cases. It's incredibly helpful. But it is not good enough. And the success of the changes in the public health order have everything to do with you. Your nose has to be covered. You must be wearing it. For folks, I hope that was an anomaly in Espanola when I traveled through. I'm worried that it isn't. And I can tell you that based on the data we do have and the complaints that come in, that the counties who are in the red are not practicing good public health. They're not wearing masks. They're traveling far too much. Their businesses aren't requiring masks as diligently as they're absolutely required to in order to be open, and they're not adhering to COVID-safe practices. And if we do that, we aren't going to be able to live and manage successfully while we have this. We're always going to have this virus, with this virus. So keep doing this good work. Double down, double down. Friendly, positive peer pressure, no violence, about wearing masks and good public health behaviors, and to all of the businesses, because I haven't thanked them, who have done above what's required in their COVID-safe practices, who advise us every day, who are hanging in every day through this pandemic. I'm incredibly honored and proud of your work. You are saving lives. You are making an incredible difference. And I have no doubt that all of you are going to help New Mexico transform its economic opportunities and success on the other side of this pandemic. Thank you, New Mexico. Be well, be safe.